Oh, you guys are back. So that means you want to know more, isn't it? Today's episode, or second episode of Dental Talks, we are going to be talking about micrognathia. Micrognathia, by its name, just means a small jaw, as in micros meaning small and gnathia meaning the jaw. So micrognathia is a little fuzzy in its diagnosis because it not only is caused because of an abnormality in its size, but it can also be caused because of abnormal positioning and dilation. Now, true micrognathia can be classified as either congenital or acquired. The etiology of the congenital type is unknown, although in many instances it is associated with syndromes like the Pierre-Robin anomalad. Remember what that was? You don't have to. I'm here to tell you. The Pierre-Robin anomalad is characterized by three particular things. The first is the cleft palate. The second is glossoptosis, which is to do with your tongue and the palate interacting. And the third is micrognathia. Something to remember is it is also associated with congenital heart disease. The form of the disease has been discussed widely, but what is a little more difficult to understand is the micrognathia of your maxilla, which usually involves the premaxilla area between your canines. So these 6 teeth comprise your premaxilla, and a deficiency in the premaxilla leads to micrognathia, which forms a dished out concave appearance. You don't want that. It's not so aesthetic. So the other thing that you have to remember is the face appears retracted, isn't it? Now, it is also known that mouth breathing is associated with micrognathia of the upper jaw. Now, how is this to go about? So some schools of thoughts say that maxilla retruded is because of mouth breathing. And another school of thought is that a retruded maxilla causes mouth breathing. Now, how is that? This is because there is, a compromised nasal and nasopharyngeal structure when there is micrognathia of the maxilla, isn't it? So now because there is a compromise there is difficulty in breathing. Now, because of the difficulty in breathing, you succumb to doing it from your mouth, which is mouth breathing, which causes the dental abnormalities associated with mouth breathing. Now, coming to the acquired form, which is in contrast to the congenital form. The acquired is mostly associated with an abnormality of the condyle. As we know, there is a growth center at the condyle which pushes the mandible downwards and forwards. So it's helping in growth. Now, any problems with the condyle can definitely affect the growth of the mandible. So ankylosis, which is trauma, infection, which can be another cause, or even sustaining to a congenital cause which causes aplasia of the condyles can all affect the growth of the mandible, which leads to micrognathia. Now, you have to be careful because there is a third thing that can happen, that is the illusion of a mandibular micrognathia. Now, how do you come about that? So basically, the mandible might be positioned more posterior to how it would be in a normal person in relation to the cranial base, or there may be a steep mandibular plane angle, which makes it just appear as micrognathic, but it's not really so. Now that we have discussed about the general basis, how will you see a patient clinically? Here is a picture to that. But one other thing that you have to remember with the retrognathic chin, the severely retruded angles, and the deficient chin button, there's a steep mandibular plane angle, isn't there? Now, another characteristic thing that you have to know, which is important and fun to remember, is the Andy gump appearance, which is a bird facies type appearance that is also seen in condylar ankylosis. This is a picture of that. So now that you have appreciated micrognathia of the mandible and to some extent of the maxilla, we end today's topic. I hope you enjoyed it. I know I did. So stay tuned for the next videos. We're going to cover most of the things and everything. Have a great day. Bye.